Hi, it's Debbie Seidel-Bickey, founder of dentalpracticesolutions.com, and I'm here today to talk about your hygiene department, and I wanted to provide answers to two of the most commonly asked questions. Number one, when do we submit for periodontal maintenance? Periodontal maintenance is first billed to the patient and or insurance company after scaling and root planing has been completed. That means that maybe the patient has an area with 1 to 3 teeth and you'll scale and root planing, or it could be 4 quadrants of scaling and root planing, but they'll return for 4 to 6 weeks later, like a post-op visit. A reevaluation is what you might call it. And at that point in time, it's considered a periodontal maintenance. You'll decide at that point in time, what is the balance point? Meaning, how long can this patient remain stable without disease in their mouth, but we've resolved the disease in their mouth by scaling and root planing, and how long can they maintain on their own? Usually it's going to be, normal patient is going to be 90 days. Could be less, could be more. That's when you'll bill for periodontal maintenance. Number two, can we alternate Profi with periodontal maintenance? Well, you see, think of it like this. Imagine the patient is diabetic or that they have high blood pressure. Isn't their doctor going to want to see them probably every 6 weeks, and they'll take their blood pressure, check to make sure the medications are working properly? If they have diabetes, they're definitely going to be doing some blood tests probably every 6 weeks. And it's the same thing with your periodontal patients. You're going to reassess at least every 90 days, meaning they're going to pick up a probe and look at those difficult areas, and annually you're going to do a 6-point screening with furcation, mucogingival involvement, recession, furcation, etc. And so you want to always bill what's appropriate for the patient. If they are a periodontal patient, they've gone through scaling and root planing, just like the diabetic patient, they're always at risk for diabetes. And it's the same thing with your periodontal patient. They are always at risk for periodontal disease. The other thing to consider is insurance payments. If you are an insurance-driven practice, and most of our dental offices in the United States and even Canada today, they do accept or they are assigned to some of these insurance companies. And many times when you alternate a Profi after they've had scaling and root planing or periodontal maintenance, that insurance company can kick out any future payments for periodontal maintenance and or future scaling and root planings. I hope that this has provided you some great insight. Also, look down at the bottom of my blog today, because I do have some tools that you can take away to implement in your office right away. I'll see you on next week's video.